Close to 300 people were killed, including several Americans, after coordinated suicide bombings on Easter Sunday in Sri Lanka.
Sri Lankan officials say they believe 7 suicide bombers from a domestic militant group carried out the attack.
This year we're doing Operation SCUBA, Sports Complex Under Bomb Attack. Good morning. Every victim will need to be triaged, they will need to be tagged, and they will need to be transported. This is Connie Kraft. I am with the Marrow Regional Training Center and the Emergency Management Department here at Stony Brook University. Let's be very conscious of following our plans. And I coordinate the training and education here at the hospital, but also for the community on Long Island and the lower Hudson Valley as well. Here in New York State, we use the START method of triage. So hopefully everybody's going to follow their training. So emergency preparedness training is what we do. And today we're going to see the result of all of that training. Very, very important in terms of safety, the following phrase: real world emergency. Real world emergency. If anybody is injured, whether it be a provider, an exercise staff member, a student victim, whoever is injured, that is the word you use to let people know that you actually have a problem, a real world emergency.
Today, university police have been alerted that there has been an explosion and some collapse of the bleachers.
Swirl yourself into a corner, two on top of each other, whatever, as if, you all just came down with the rubble.
And upward of 40 to 50 victims possibly injured during this event. At that time, the university police responded, as well as our volunteer ambulance corps from Stony Brook University.
Red tag, going straight through, family?
They'll be sorting out the patients, treating the patients, or what we call, sorting out medically, triaging, and transporting them to the hospital.
Be calm.
Today we brought down simulation gear for the mass casualty exercise. We've done this for many years with Stony Brook successfully.
Use the wax to anchor it.
And what we do is we try to make the exercise as real as we possibly can for the responders, so that they're seeing, feeling, hearing, smelling, all of the senses that they will be experiencing during a very bad day. Behind me is the moulage team that are taking all of these student volunteers from Stony Brook and doing the actual wounds that are going to be presented.
It's fine, let it drip. Yeah, let it drip.
So these two family members, you guys are squared away. Okay. There are new people, new healthcare providers, whether it's EMTs, nursing, people within the hospital, people within the healthcare coalition around the community. New people are coming all the time. We're getting them familiar with what's happening. They're getting training, and so exercises are a really great way to evaluate that training, evaluate that education.
So the emergency department is participating in the disaster drill. We are a multidiscipline team, nurses, doctors, inpatient services, the surgical services, the medical services, we're all participating in this drill. There will be 50 patients or more coming to us.
Okay, so she's tachypnic, and any other obvious injuries other than the facial injuries?
No other injuries.
Okay. What do we know about this patient? Who's going to give me a report on this patient?
So the law enforcement response will be the initial first responders, assessing what's happening and making sure the scene is secure and safe for EMS and the fire department and any other additional resources that are needed to be able to respond.
This morning, we received word that there was an explosion across the street as a drill. Patients are being transported to our emergency department for evaluation and treatment here at Stony Brook.
Chest, upper left, crushing injury. You can't speak. Okay. So you were in a serious, it was a bombing?
It was bombing. She was crushed by the bleachers.
All right, so you've got a lot of injuries to your chest, and so you're having trouble breathing. We're going to have to sedate you, knock you out, and put a tube down your throat, okay, to breathe for you. It'll make you more comfortable.
So I finally got a black tag number. They said 4.
There's 4 confirmed black. I'm going to need some beds for inpatient boarders that are there, and I also need an additional crash cart in the PACU.
In the room behind me is the Critical Incident Command team that has been assembled from Stony Brook University Hospital to help allocate resources and physician nursing care to the patients who are being brought in here, also to give information to the families of the people who were involved in the incident across the street.
We are going to move patients out of antepartum into the postpartum area to open up that area to decompress some more of the patients out of the ED.
We've received 11 of the 18 red patients, 3 of the 15 yellow patients, 9 of the 11 green patients. So that is 23 of the expected 44 patients.
I need one of your crew members to move the ambulance so that we can facilitate.
My position is as the operations manager is to coordinate the patients that come through radiology, exercising our resources that are available between CT, diagnostic, MRI, ultrasound, and special procedures. They're critical to the patient, so we're the first line to diagnose a patient who has a critical injury, then give the information to the treating MD, and then they can determine what extensive they need to treat the patient. Well, we have to prioritize them, so based off their acuity, they'll let me know, and then we'll prioritize where they go and which areas they need to go to.
That goes with them.
Patient access is required to assess and document all entering patients as they come in so that we can identify them to ensure safety identification for our patients. This year, social work and various services such as pastoral care and interdisciplinary departments are working with us to ensure that patients' families are kept in contact and we can give them information about their loved one as soon as possible.
Aware of what's happening, okay?
Is my mom?
I don't know if your mom is here, but we'll get someone to try and find her, okay?
I'm sitting in this hospital right now, looking for my girlfriend. I don't know. You tell me. Sure.
Our role here at the Family Assistance Center is to assume that families are going to become streaming in to find out if their loved ones, if their children, if their people that they're connected to were part of this disaster, and they want to find them. So there's an issue of identification and unification, but also to help people decompress and de-escalate because they're going to be very upset, scared.
We also have photographs taken which are available to further identify patients and also to assist when family or visitors come to identify their loved ones.
This is a newer process that we tested last year and now we're testing again this year, and it's working really well this year. Pictures are being taken of the victims in the emergency room level through the patient access department. Those pictures are going up on a safe site via the iCloud, protected so it's HIPAA compliant. We're putting them into files based on identifying features, and then we're sharing the pictures based on what we're hearing from the families.
Communications is very central when there's an emergency or a disaster of any sort, and we work together as an integrated team.
Suffolk County Police and the FBI are working on that and controlling the messaging. They have not released anything yet. What they're saying is the investigation is ongoing. As the public information officer, we develop the communications for external media, for responding to media requests and updating the media on a timely basis about what has transpired and who's being cared for in the hospital. We do provide updates on the number of injured, the number of deceased, and the number of people who are currently being cared for.
A campus of this size, we essentially treat it as though it's a small city. It is a huge responsibility, one that we take very seriously. We do this every year, or at least once a year, in partnership with the hospital, as well as smaller drills and exercises on our own. So it's a great opportunity for us to work both with our on-campus resources as well as with our partners from local, state, and federal emergency responders. I think there's a sixth sense that you build over time. Certainly, I'm in my 21st year in law enforcement. So for a venue with this much capacity, there's a lot of things happening, and certainly we're always looking to see what's going on. Not that we're suspicious of everybody, but I'll call it just being very aware and being very vigilant.
If you could do it, do it, do it, do it, do it.
You gotta start patting people down as well as they walk out.
Oh, yeah?
Yeah.
How many do you have so far? We have 3 yellows and 2 reds. I need to go back and get more tags from my triage officer.
Okay, how about we start getting some crews in here, start treating and start moving them out to the system, right?
So the first thing we want to do when we hear about this is free up as many physicians and extenders as we can. Get the operating rooms available so we put all elective cases on hold and get the right equipment into the rooms to care for our patients. So it's important that we have an anesthesiologist working with the surgeon and emergency physicians in the emergency room and get those patients to the operating room as quickly as possible so that care can be provided.
I was asked to come in and help evaluate and guide the EMS operations. Suffolk County policy is the plan that guides agencies as they progress through an evolving incident.
And I need a patient count of how many greens or what.
So we want to ensure that the plans that are written in the Suffolk County Mass Casualty Incident Plan is followed out. We want to make sure that the responding agency in charge establishes a unified command, and that they are using the start triage method.
Right now we're here on the role of MedCat. MedCat stands for Medical Crisis Action Team. We come together as a team when there is a large-scale incident. The 28 officers that are assigned to our team are Advanced Life Support Care Officers. We are paramedics and EMT critical care providers.
There'll be numerous victims simulated with injuries to allow our EMS ambulances to come in, treat and transport to the hospital.
So we're one part of this huge pot
My role is to oversee and coordinate all the pre-hospital providers that will be responding into this drill as mutual aid departments. I am also responsible for the overall safety and well-being of all players within this drill.
So we're not crossing their boundaries.
We're simulating the incident to be as real life as possible, but throughout practices of drills, we want to make sure that the individuals that are involved in the drill, their safety is number one concern.
The medical control's responsibility is to initiate hospital polling, to notify the receiving hospitals of the incident, scope of the incident, and keep them apprised of what's going on during the incident. Most of the time it's done through cell phone service, but we also have an 800 radio system that we can communicate with them with.
So today my role is to evaluate what we call the forward triage function of disaster management, taking the assessment and evaluation that occurs initially when patients present to the hospital. Patients with varying degrees of trauma that starts in the emergency room but extends to our support services as well as our operating rooms and our units.
Yeah, so doing this exercise, I'm working on evaluating and the ED Incident Command and the ED treatment components of the exercise and looking at how they respond to the incident and manage both resources, flow of patients, and treatment. Yeah, these drills are, essential in allowing us to prepare to work with local EMS agencies, allow the EMS agencies to evaluate, treat patients, get comfortable in this, bring them into the hospital, practice things like communication, treatment, how we move patients out of a crowded emergency department and allow us to care for patients in a disaster situation.
We're going straight, yeah.
So, as a result of these drills, we have a chance to evaluate immediately afterwards and also discuss within the department and through other meetings to look at ways we can improve and improve processes to help with an actual situation in the future.
So this is the best way that we can evaluate our staff, our emergency response people, EMS, our police department, as well as all of our hospital staff as handling any type of a large-scale event.
I consider the Stony Brook exercise to be a gold standard. It is done well, it is done right, and it improves every year that we do it. So it's noteworthy that it's a gold standard that we actually incorporate into our training for exercises. We utilize the videos from the exercises as part of our curriculum, and we're grateful to have the opportunity to support Stony Brook year on and year on. Not that nothing ever goes wrong. If nothing went wrong, you wouldn't need the exercise. There's certainly always something new to learn, but continuous improvement all the way through, year on year, is amazing, and this is truly one of the gold standard exercises that we are fortunate to support every year.
I want to just say a big thank you to everybody that's involved, everybody that's participating, from the state agencies to the county to everybody within the EMS community and our hospital people as well. This takes a lot of effort and a lot of planning, and I really appreciate people taking the time out to be here with us and be involved. So let's be safe, let's have a great exercise day. 2019, Operation SCUBA. So this is why we do this. We have students here today and they're learning a lot about emergency management. These are my interns from the Emergency Management Health Science Center program. This is Linda, this is Andrew, and this is Isabella. And they're all taking leadership roles today, and hopefully they're going to have a great time with the exercise, and they're going to be our emergency managers in the future. So you all ready?
Yes, of course.
Okay, let's do it.